Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about deviated nasal septum. Now, I have recently done a case presentation on DNS as well. You can check it out over there for a complete clinical case discussion on this particular case. But today we'll dive into this topic in general and we'll talk about how does a case of DNS present and what are the different types of DNS that you could encounter and how are we going to treat the case. You can also now purchase my notes. I've added links in the description. Let's get started. So first let's talk about what is DNS. So DNS is deviated nasal septum. Now this is actually a very common occurrence seen even in normal individuals who do not present to you with any symptom. Having the septum exactly in the midline is not a very common thing. You'll find slight deviations in a lot of people when you check their noses. But when the DNS ends up causing some kind of symptoms, like say for example, the most common symptom that it causes is nasal obstruction, or say it is leading to middle ear infections, or there is epistaxis as a result of it. At that point, you have to decide to treat the DNS. In that case, you do not just ignore the presence of it. So, what is deviated nasal septum? This is a condition in which the septum, instead of being placed centrally, now let's look at the first image over here. This is what a normal septum is supposed to look like. It's supposed to be somewhat centrally placed so that it divides the nasal cavity into two equal parts, two equal chambers of the same size. Here, what happens is the septum gets deviated to one side so as to increase one side of the cavity at the expense of the other. Now, let's look at the image on the right side. This is a C-shaped deviation that we are seeing, and you can see that this is deviated like this towards the right side. As a result, the nasal cavity on the right side has become narrower compared to that of the left side. So, in DNS cases, they do not have any age predisposition as such. It can be found at any age. Even in terms of gender predisposition, it affects both males and females, but sometimes it seems to be more in case of males than in case of females. And DNS is actually the most common cause of nasal obstruction. Now, this is something you have to remember. This is a very important Viva question or even a MCQ question for that matter. So let's try to understand what is the reason behind DNS forming. Now, starting with the causes of DNS, we have a lot of them. So first, the most important cause would be trauma. Next, we have developmental errors. Third, we'll talk about high arched palate. We'll talk about any mass in the nose. And then we have some racial factors, and then we have some hereditary factors. So these are the 6 factors that we'll talk about in the etiology of DNS. Now, starting with trauma. Trauma is actually the most important factor over here. So there can be different types of trauma. So, for example, number 1, if you have a lateral blow from on the nose. So, let's look at the first image over here. So, this is what we are seeing from the front. Say if we have a lateral blow of the nose from the side, what happens is the septal cartilage can get displaced from the vomerine groove and the maxillary crest. Now let's look at the second image here. This is the image of the nasal septum, the parts of it. So we have the septal cartilage here, we have the perpendicular plate of ethmoid, vomer, and this is the crest of maxilla. So here what happens is, if you get a lateral blow from the nose, the septal cartilage can get displaced from this vomerine groove and from the maxillary crest inferiorly. So that is how it can lead to displacement of the nasal septum. Second, say you are getting a crushing blow right from the front. It hits you right over here. This in this case, it can either lead to buckling of the nasal septum or the twisting of septum. It can even lead to fractures of the nasal septum and duplication as well, and it can even get divided into smaller fragments and get displaced from each other. So that's what a crushing blow from the front can do. And it's actually, you'll see when you take a history there, if you take a very good history from your patient, sometimes you can trace it back to injuries to the nose that they might have faced during the time of their childhood, and this is often missed very easily. So there can be another third kind of trauma where the trauma occurs during the time of birth. Now, during the time of birth, if there is difficult labor or forceps delivery being done, then what happens is the nose can get pressed during its passage through the birth canal, and that injury should be immediately attended to, because otherwise they can end up causing a deviated nasal septum later in life. So that's our first cause over here, which is trauma. Now, moving on to our second cause. Second cause is any developmental error. Now, as we know, the nasal septum is actually formed by the tectoseptal process, which descends slowly to meet the two halves of the developing palate in the midline. So this you can see over here, this is the nasal septum, and these two are the developing palate. It's the developing palate, the two halves of it, and slowly these three, they meet in the midline. This is how the nasal septum gets formed. Now, during the time of primary as well as secondary dentition, a lot of development keeps happening in the palate region over here. Now, this palate eventually it descends a little bit and it widens up so as to accommodate the teeth. Now, any issue in this whole process over here, if there is any unequal growth happening between the palate over here and the base of the skull, it can lead to buckling of the nasal septum. Any kind of deviation from the normal developmental process. So that's why a developmental error can also be one of the causes of DNS over here. And you'll also see that DNS can be actually seen in cases of patients who come to you with cleft lip or cleft palate, or even with some kind of dental abnormalities. They end up having a problem with the septum being on the deviated towards the other side. So that's how developmental error can cause DNS. Now next, moving on to high arched palate. Now let me show you an image over here. So this is what a high arched palate looks like. So this is our high arched palate, and when this is present, especially you'll see in cases of mouth breathers, chronic mouth breathers, especially in children, young children who come to you with mouth breathing and snoring, when you examine the patient, you'll find that they have adenoid hypertrophy. And a long-term history of such a case, you'll see that they have adenoid facies. And in adenoid facies, one of the things that you'll see is that they have a very high arched palate. And as a result of this high arched palate, you end up having a DNS like this because of the buckling of the nasal septum happening. Now, if you want to know a little more about what are the different features that you see in adenoid facies, I have a separate video on that. You can check it out over there. So there goes our third cause, which is high arched palate. Next, say we have any mass in the nose, any kind of tumor developing in the nose. It could be an angiofibroma or a rhinosporidiosis or inverted papilloma. If this tumor, or any polyp also for that matter, when it starts to grow, if it grows, say the tumor has risen over here. Now, if it starts to grow on the opposite side, towards the opposite side getting larger, what it will do is it will push, if the septum is over here, it will push the septum towards the other side, resulting in deviation of the septum. So a tumor or a mass in the nose could also be a reason why you have a deviated septum. Other than this, we have some racial factors like Caucasians are usually more affected by this, and hereditary factors where it has been seen that members of the same family can actually have DNS. So these are our 6 causes of DNS over here. The first is trauma, which is most important. You can have birth trauma, you can have trauma from accidents later in life. Second is we have developmental error. Any issue in development of the palate and the anything between the palate and the base of skull can lead to buckling of the septum. Then we have high arched palate in mouth breathers. leading to DNS. Then we have mass in the nose and some racial and hereditary factors. Now let's discuss what are the different types of DNS. Now we can talk about the different types of DNS in 3 classifications. First is, we know that the nasal septum has bony parts and cartilaginous part. If you look at the image over here, the septal cartilage, this is the cartilage part, and the rest of it is the bony part. So the 2 major bones are here, the perpendicular plate of ethmoid and the vomer, and the smaller contributions are coming from the rostrum of the sphenoid, the nasal spine of the frontal bone, the crest of the nasal bone. Then we have the anterior nasal spine of maxilla, we have the crest of the maxilla, and we have the crest of the palatine bone. If you want to know more about the anatomy of the nasal septum, I also have a video on this. You can check it out. I'm linking it above. So we know that our septum has cartilaginous part and bony part. So our first classification says that either the deviation can involve only the cartilage, or it can involve only the bone, or it can involve both cartilage as well as bone. So that's our first classification. Now moving on to our second classification. So in our second classification, this is based on how the septum looks like. So we can have, let's look at the images and we'll talk about each one of them. So we can have a C-shaped deviation. So in C-shaped deviation, what happens is, as you can see in the image, the nasal septum gets deviated in a C-shaped manner to one side. As a result of which, you can see that the nasal cavity becomes wider on the concave side. And because the nasal cavity has become wider on the concave side, we'll have more airflow happening over here. Now, because there is more airflow happening on the concave side compared to the convex side, as a result of this, there will be increased drying and heat loss from the mucosa. Now, because there is so much drying and heat loss happening, there is a need to regulate the airflow and to warm and humidify the air. If you look at the physiology of the nose, one of the most important functions of nose is that the air that we inspire, it is warmed and humidified in the nose itself. Now, because there is increased drying happening on the concave wider side in this kind of a deviation, there are 3 things that happen. One is there is venous sinusoidal engorgement of the turbinate happening. Second is we see a mucosal hypertrophy. And third, in very long-standing cases, you can have bony hypertrophy as well. And these 3 things together, what it does is it leads to the development of compensatory hypertrophied turbinate in the concave side of C-shaped deviations. And this is how it restores back the nasal resistance and improves the air conditioning inside the nose. So that is why in C-shaped deviation, you'll see when the septum is grossly deviated to one side, the wider side ends up with a compensatory hypertrophy turbinate. And as a result of this, even though we are seeing that the deviation is to one side, so technically you would imagine that this patient would come to you with unilateral nasal obstruction. But what happens is, because of the compensatory hypertrophy turbinate, they actually come to you with bilateral nasal obstruction. So that's about our C-shaped deviation. Now next is we have the S-shaped deviation. So if you look over here, this is what an S-shaped deviation looks like. So this can either be in the vertical plane or it can be in the anteroposterior plane. And as you can imagine by looking at the image over here, this will cause a bilateral nasal obstruction because there is deviation happening on both the sides of the nasal cavity. Third is, let's look at this. This is a caudal or an anterior deviation. Let's look at the image in this part. This is the caudal or the anterior part where it gets deviated. So what is this exactly? Here, what happens is the caudal end of the septal cartilage, it gets displaced. Now if you look over here, this is the caudal end of the septal cartilage where it sits on the maxillary crest and the anterior nasal spine. When the septal cartilage in this caudal end gets displaced from its normal position into one of the nasal cavities, this leads to the formation of a caudal septal dislocation or an anterior dislocation. And as a result of this, the primary problem that this person will face is a anterior nasal obstruction. And this, I'll show you an image right over here. This is what it will look like. And this is best seen when you just tell the patient to tilt their head backwards and you raise the tip of the nose and you're able to see a deviation right over here. And as you can see, this will be causing an anterior nasal obstruction. So this is the importance of finding out about the caudal septal dislocation. So we saw that C-shaped deviation will can have an unilateral nasal obstruction in the beginning, but it progresses to develop a bilateral nasal obstruction due to compensatory turbinate hypertrophy. Then we saw an S-shaped deviation that it will cause a bilateral nasal obstruction. Third, we saw in caudal or anterior dislocation that it causes an anterior nasal obstruction. Now this brings us to a fourth type over here, which is a septal spur. Now, what is a septal spur? This is a very important definition. You'll often be asked if you have got a case of DNS in your exams. Now, a septal spur is basically a sharp, shelf-like, bony projection. It is important to remember here that this is a bony projection that arises from the bony cartilaginous junction. This is also very important. It only arises in the bony cartilaginous junction of the nasal septum and it projects laterally into the nasal cavity. So this is what a spur will look like. As you can see, it is projecting into one of the nasal cavities. And the most common site where the spur usually forms is the junction of the vomer and the septal cartilage. So this is the junction at which it usually forms. And this spur, how will this patient present to you? When this spur goes and presses on the lateral wall, you can see here how it is pressing on the turbinate. So when it goes and presses on the lateral wall, it can end up causing headache. And also on the tip of this spur, you can see how pointed it is, right? So the tip of this spur, the mucosa which is overlying the septum gets very stretched. And as a result of which, even the vessels within it also get stretched. So a septal spur case will often present to you with recurrent epistaxis. So a septal spur case will not only come to you with a nasal obstruction, it will also come to you with headache, as well as epistaxis. So that is all about the spur. So if we had to define spur, we will tell that a septal spur is a sharp shelf-like bony projection which arises from the osteocartilaginous junction of the nasal septum projecting laterally into the nasal cavity. And our fifth type of DNS over here would be a septal thickening. Although this is a lesser known type that is seen, this will happen if you have, say, a case of septal hematoma and it gets organized. It can lead to septal thickening, or even overriding of fractured or dislocated septal fragments can lead to septal thickening. So this is our second classification where it is depending on the shape and the type that we are seeing over here. So we have 5 types here: the C-shaped deviation, S-shaped deviation, caudal or anterior deviation, septal spur, and septal thickening. Then we'll talk about our third type. But before we do that, let me show you this is what a spur looks like when you put an endoscope inside the nose. Third type is the Cottle's classification. Now in Cottle's classification, we have 3 types of DNS, and depending on which type, we have different treatment management. So the first type over here is a simple DNS. Now in simple DNS is the type where we see a very mild deviation of the septum which is not causing any nasal obstruction. So we do not need any kind of treatment over here. Second is we have obstructed DNS. Now obstructed DNS, in this we have a severe deviation of the septum which may even be touching the lateral wall of the nose. But when we apply vasoconstriction, we see that the turbinates shrink away from the obstruction. So because of this, you may not require surgery over here. Sometimes just by using decongestants, the problem can be solved. But you may also need to do surgery in some cases. Our third type is an impacted DNS, where we see a marked angulation of the septum along with a spur, which lies in contact with the lateral wall of the nose. These cases definitely need surgical management because they will not have any relief on application of a vasoconstrictor agent. So you have to perform a septal surgery to correct it. So this was the Cottle's classification of DNS, another important Viva question you should be knowing. So these are the three different classification that you should be mentioning when you are asked about what are the different types of deviated nasal septum. Next, let's talk about what are the clinical features that a patient will come to you with. So first, let's discuss about symptoms and then we'll move on to discuss the signs. So all the symptoms that you'd be seeing are nasal obstruction, headache, sinusitis, epistaxis, some smell abnormalities like hyposmia or anosmia, external deformity of the nose, and middle ear infection. Now let's discuss each one of these over here. So first, starting with nasal obstruction. Now nasal obstruction is the most common symptom that usually a case of DNS presents to you with. Now this nasal obstruction can either be unilateral or bilateral depending on the kind of septal deviation that the patient has come to you with. As I've discussed just before, all the different cases and what kind of obstruction they present to you with. So there are two cases in which you will be seeing a bilateral nasal obstruction. That will be, first is in a case of S-shaped deviation and in a case of C-shaped deviation with a hypertrophied turbinate. These are the two cases where you will be seeing bilateral nasal obstruction. And the second thing you need to know here is in case there is a high septal deviation, then these cases actually they come to you with more nasal obstruction because when we are inspiring, again, if you look at the physiology of the nose, the inspired air, the respiratory currents which are entering our nose, they actually pass through the upper part of our nasal cavity. So any deviation which lies higher up in this region, they'll actually cause more of a symptom of nasal obstruction than the ones which lie low in the lower part of the nasal cavity. So that is very important to understand. Then we have already discussed also about why there is a compensatory hypertrophy turbinate on the wider side of the nose because there are three reasons. One was venous sinusoidal engorgement. Then we had mucosal hypertrophy, and in very long standing cases, we had bony hypertrophy. And these three factors together, they lead to a compensatory turbinate hypertrophy on the wider side of the nose. So that's about nasal obstruction. Now, along with this, there comes a term which is known as paradoxical nasal obstruction. Now, do you know what that means? So here, what the patient will complain to you is, they'll tell you that they have unilateral nasal obstruction, but when you check the patient, you'll see that the septum is actually deviated to the opposite side. So they do not have nasal obstruction on the side of the deviation, but rather on the wider side of the nose. Now, that is the reason why it's called paradoxical nasal obstruction, because it is not lining up with the DNS that you are seeing on examination. So what happens here is these patients, they usually have very long standing nasal obstruction to the deviated side. So because it has been very long standing, they kind of get accustomed to it and they are no longer aware of it. So they do not notice the nasal obstruction on the deviated side anymore. Now, again, coming to physiology of the nose, I'll make a separate video on it. If you have learned about the nasal cycle, you know that we have mucosal congestion which occurs in this nasal cycle. Now, in nasal cycle is actually a normal physiological process. So when there is mucosal congestion happening in the nasal cycle, it results in this feeling of additional intermittent nasal obstruction on the side of the nose which is wider. And then when this obstruction happens, the patient starts to feel as if they are having nasal obstruction on the other side, although this is a normal physiological phenomenon. and therefore this ends up becoming the dominant symptom which is appreciated by the patient. That's because they have kind of become accustomed to the nasal obstruction on the deviated side. So when these patients come to you with nasal obstruction, complaining of a obstruction on the side which is opposite to that of the deviation, that is known as paradoxical nasal obstruction. Another favorite question of examiners. So that's about our first symptom, which was nasal obstruction. Now next, let's talk about headache. Now headache can happen because of different reasons. The first reason would be, say if there is a septal spur. Now when there is a septal spur, I showed you on the image that it can actually press on the lateral wall of the nose. And especially when it presses on the middle turbinate on the lateral wall, what it ends up doing is it compresses a nerve which is known as the anterior ethmoidal nerve. And when anterior ethmoidal nerve gets compressed, it causes a disease which is known as Sludder's neuralgia. You feel a very neuralgic pain in the lower half of the face, and this is also associated with rhinorrhea. So, Sludder's neuralgia can be one cause of headache over here. Second, now, when we have a DNS which is blocking off the osteomeatal complex, when osteomeatal complex gets blocked, we know that a lot of our paranasal sinuses drain out into the osteomeatal complex. So when the sinuses get blocked, because of the osteomeatal complex being blocked, so we have a blockage in the drainage of sinuses, and this will lead to development of sinusitis, and hence you'll have headache as a result of sinusitis. Third reason, now because the osteomeatal complex has gotten blocked, so we know that the sinus ostium is blocked. Because the sinus ostium gets blocked, it leads to the development of this negative pressure inside the sinus. So you feel like a vacuum-like feeling inside the sinus, and this leads to the development of something which is known as vacuum headache. So these are the three ways that a case of DNS can end up causing headache in the patient. Next, moving on to our third symptom, which is sinusitis. As I just discussed, sinusitis will happen when the sinus ostia get blocked, and because the sinus ostium is blocked, there is poor ventilation and drainage of sinuses, leading to the predisposition of recurrent sinus infections in these patients. Fourth symptom here is a case of epistaxis. Now, epistaxis can happen because of two reasons. Now, number one reason over here would be that if there is a spur present, I showed you how in case of a spur, you can see that it's very pointy. So you can see how the mucosa and the vessels which lie inside, it kind of gets stretched because of this pointy projection, and that can lead to development of recurrent epistaxis. And the second cause why epistaxis can happen over here is the mucosa which is lying over the convex side of the deviated septum. It gets exposed to a lot of dry air currents. Now, because of exposure to dry air currents, it can lead to the development of crusts inside the nose. And when you remove these crusts, when you try to remove these crusts, it can lead to some bleeding inside the nose. So these are the two reasons why you can have epistaxis in a case of deviated nasal septum. Next is smell abnormalities. Now, in a case of severe DNS, the inspired air that has to reach the olfactory area is not able to pass and reach the olfactory area anymore. Therefore, because the inspired air is getting blocked and it's not able to reach the olfactory area, you can actually have a loss of sense of smell. If there is a partial loss of smell, you develop anosmia, and if you have a total loss of smell, you can have anosmia. Next symptom is external deformity of the nose. Now, sometimes if you look at our image over here, you can see that this is our upper lateral cartilage over here. You can see if you look at the nasal anatomy properly, you'll be seeing that the septal cartilage is actually also converging with the cartilages on the dorsum of the nose. So it can be associated with a deviation of the cartilaginous or both cartilaginous and bony parts of the dorsum of the nose, even deformities of the tip of the nose or the columella. So there can be an associated deformity that you see in the external nose as well. And lastly is middle ear infection. So we know that the DNS, if there is a DNS present, it can end up blocking the eustachian tube. Now, when the eustachian tube gets blocked, it leads to eustachian tube dysfunction, and as a result of which, this can predispose to middle ear infections happening. So these are the different ways that a person with a patient with a DNS will present to you with. Now, what are the different signs that you will be seeing when you examine the patient? So when you examine the patient, first of all is you should be looking at the external nose. You look for any external nasal deformity that the patient might be having. After that, we'll perform an anterior rhinoscopy of the patient. So when you perform anterior rhinoscopy, we know all the different types of DNS that could be present. So we'll be on the lookout for each one of them. So we'll raise the tip of the nose to make the patient tilt their head backwards. We'll look for any kind of caudal dislocation. We'll see if the DNS is present, which side is it present towards, what is the type of the septal deviation. And we'll also check the opposite side of the deviation to see for a compensatory hypertrophy of the turbinates. Then we'll also look at the nasal mucosa and see whether it is normal or is it congested. And we'll check for any presence of discharge. If we see any presence of discharge, it can indicate towards the development of sinusitis in these patients as well. So in that case, your treatment profile will change. You'll have to perform endoscopic sinus surgery, FES, along with doing septoplasty to correct the DNS. So this is something that you'll have to look out. Again, you'll also, another thing you have to check is you have to recheck after application of a vasoconstrictor agent to see whether the mucosal response is present or not, whether you even need to do a surgery in these cases or not. So these are all the findings of anterior rhinoscopy. Next, we'll perform some functional tests of the nose. First is the cold spatula test, where you will be seeing a decreased fogging on one side, on the side of the DNS. Second is we'll have the cotton wool test, which will also show a decreased movement on the side of the DNS. And third is the Cottle's test. In Cottle's test, what you do is you pull the cheek away from the midline and you see whether the nasal obstruction on that side improves or not. If the Cottle's test is positive, you'll see that the obstruction is at the level of the nasal valve. And usually, if there is an obstruction at the level of the nasal valve, the obstruction is actually more severe than in any other region. If you want to know more about Cottle's test, I have a video separately on this. You can check it out over there. So this is all the examination findings that you will be seeing in our patient. Now let's move on to investigations and treatment of the patient. Now, coming to investigation, usually in most cases, we do not need to do anything. But if we are suspecting a case of sinusitis along with it, then we can perform an X-ray PNS, which was earlier done. But in today's times, we do mostly CT scan of the PNS if we have any signs which are suggestive of rhinosinusitis. And a CT scan is also done if you are planning for a surgery in the patient. Next, let's move on to the treatment. Now, as I mentioned, a lot of people will have deviations of the nasal septum. But if these deviations are not producing any symptoms, in that case, you do not need to do any treatment at all. But say any case of DNS has come to you with any kind of symptoms. It could be a nasal obstruction, it could be headache, it could be epistaxis, or it could be a middle ear infection. In all of these cases, the only treatment that you have is to perform a surgery. Now, next question is, what surgery would you be performing? So we have two surgeries over here. We have submucous resection or SMR, and we have the septoplasty. Now, SMR was something that was done earlier and it is not done today anymore because it is a more radical excision of the septum, and where we elevate the mucopericardial flap on both sides of the septum and we remove a lot of the cartilage. This is a very radical surgery which is not preferred nowadays. Today, what we do is septoplasty, which is a much more conservative approach to septal surgery, where we only remove only the deviated parts of the septum, and we try to correct the rest of the septal deformity and reposition it back. So that's our primary treatment over here. Now I'll make a separate video on septoplasty where I discuss its indications, contraindications, and what are the steps involved over there. Lastly, let's talk about complications of DNS. Now, say there's a case of DNS, very long-term, long-standing case going on untreated. What are the possible complications that you can develop? First is because you're not able to breathe through the nose, what the patient can end up doing is they can become habitual mouth breathers. And now, when you start breathing from the mouth and that becomes a long term habit, that will predispose to recurrent infections of the pharynx, larynx, as well as the lungs. Also, in cases of DNS, chronic DNS, you'll end up seeing recurrent rhinosinusitis because the sinus ostium gets blocked. So, therefore, the sinus ventilation and drainage gets impeded. Third is the patient can develop atrophic rhinitis on the wider concave side of the nose because the concave side becomes much more roomier and wider, and the air currents, there is an increased flow of air currents passing through this side. Over a long period of time, it can lead to the development of atrophic changes. And lastly, it has also been seen that DNS can act as a trigger for bronchospasm in asthma. So this is all about DNS. If you have any doubts regarding this, please note them down in a comment section and I'll get back to you. Thank you.